না চলে আসছে স্টুডেন্ট ডিয়ার স্টুডেন্ট গুড মর্নিং আশা করছি সবাই ভালো আছো আজ আমরা আলোচনা করব পরীক্ষায় কেসগুলি কিভাবে এক্সামিনেশন করতে হয় তারপর তার থেকে কিভাবে ভাইবা পরীক্ষায় আনসারগুলি করতে হয় বাই দিস টাইম আমরা অটোলজির ক্লাসগুলি মূল লেকচারগুলি শেষ করে ফেলেছি এক্সেপ্ট অপারেটিভ সার্জারি এর মধ্যে হয় দুইটা টপিকস আমাদের বাকি রয়েছে এগুলো আমরা কেস আলোচনার পাশাপাশি ওই টপিকসগুলো আলোচনা করে ফেলব আজ আমরা স্টার্ট করছি অটোলজিক্যাল কেসগুলি কিভাবে পরীক্ষা এক্সামিন করতে হয় তার উপর স্টেপ ওয়াইজ ডিসকাশন করব পরীক্ষায় মূলত রাইনোলজি অটোলজি এবং লেরিঙ্গোলজি থেকে কেসগুলি দেয়া হয় তার মধ্যে এয়ার স্পেশালি CSOM very common topics তো আজ আমরা শুরু করব মূলত how to examine of an otological patient and then it proceed to details about the viva discussion আমরা ENT এক্সামিনেশন গুলো সাধারণত বসে করি means position of the examiner and position of the patient is sitting face to face এখানে আমাদের কিছু ইনস্ট্রুমেন্টের হেল্প নিতে হয় এর মধ্যে হেডলাইট অরাল স্পেকুলাম সাথে জবসন হর্ন প্রুফ আরো কিছু আনুষঙ্গিক ইনস্ট্রুমেন্টের দরকার হয় এগুলো আমরা পরীক্ষার সময় তোমাদের দিব আজ আমরা এখানে একটা ছবি দেখা যাচ্ছে hope you can able to see the picture what I have shown it here ছবির মধ্যে এক্সামিনারের সামনে পেশেন্ট এবং এক্সামিনার মাথায় একটা হেড লাগিয়েছে এবং তার থেকে লাইট ফোকাস করছে এক্সামিনিং এরিয়াতে দ্যাট মিন্স আমাদের এক্সামিনিং এরিয়া ইজ ইয়ার অন্যান্য পরীক্ষার মতো এখানেও তোমাকে শুরু করতে হবে ইন্সপেকশন দিয়ে নাও examination to be start with inspection in inspection you have to see about the pre-auricular region auricle and post-auricular region sometimes above and below the auricle to be seen. This is the anatomy of the pinna, as you can see on the picture. Now, on inspection, after focusing your light on the ear, you can able to see the pinna proper, where you have to see about the auricle and other anterior and posterior part of the ear, and then stepwise তোমাদের দেখতে হবে external acoustic canal, tympanic membrane, and then middle ear. Now, on inspection, you have to know about the size of the pinna, shape, color, and position of the pinna. Sometimes few patients have no pinna at all. It is called anosmia. Sometimes few people have, or few patients have, small pinna. It's called microacia. Sometimes even a big pinna is seen. It is called bad ear. And then the shape. Patient pinna sometimes may appear as cauliflower like ear. And then if patient is suffering from pericarditis like disease, then the color of the pinna will be changed to reddish. In few patients, if disease on the posterior part of the pinna, means at the mastoid area, which bulges and causing the pinna displace forwards. So, moreover, you have to see any visible swelling in front or behind the ear as well. Sometimes visible scar mark to be noted if it is there. Sometimes even some pre or post-auricular discharging sinus is seen. If it is in there, you have to mention it. And then palpation. Again, focus your light on the ear and do gentle and firm pressure over few areas in the pinna and post-auricular region to elicit pain, means tenderness, for excluding some disease condition. Among it, tragal tenderness is one of the important place. Sometimes examiner may ask to you how to elicit tenderness. Then you have to see this part of examination with your patient. As I mentioned it earlier, inspection, humor disease condition may noted if these are present in that particular patient, especially pre-auricular sinus, sometimes fistula or scar mark, or even visible swelling like cystic or lymphadenitis. And then post-auricular region that we call mastoid region. You have to see whether there is any scar mark or any skin changes, any visible swelling, or even any fistula is there or not. Sometimes mastoid contour may be changed in the particular patient who have mastoid disease. If the otological disease is extend into the neck, that means in few conditions where mastoid disease may extend into the neck as Citylis abscess, on Beagle's abscess, Lux abscess. These are the conditions where you may have to examine even neck part of the particular patient. That issue you have to cover the neck examination as well. After examining the PINNA, you have to examine the external acoustic canal. It means next part of the ear. As this part of the ear is not seen by your naked eye, so that you have to place or focus your light through the ear canal by using a speculum called oral speculum. There are different types of speculum. It may metallic or plastic made, and variable size is also there because ear canal is sometimes variable in size in different individual. So need to choose your speculum for the particular patient. Recommendation is maximum diameter size of the speculum is suitable for doing examination properly. Here, if you use small size speculum, which sometimes may cause pain particular patient, or you cannot able to see the expecting examining area. So better would be use maximum diameter speculum. During uses of speculum, you have to pull the patient ear like upward, backward, and laterally, because ear canal is not an straight line or a straight way. It is placed as a bit uneven. So for better visualization of the particular area, you need to do some pulling of auricle as upward, backward, and laterally. See the external ear and other part of the ear. Here is outer part is auricle, which is continuous with the external acoustic canal. By this time, you know about its anatomy, where it has cartilaginous part and the bony part. The canal is, see, the uneven. First part is wider, then it become narrow on its progress. On inspection of the external acoustic canal, you have to look for any furuncle, any visible swelling, or any fungal infection or fungal like mass is present in the meatus or not. Sometimes you may get infected wax, sometimes may have polyp or even tumors. Sometimes ear canal may bulge at the or down to the ear canal due to complication of particular disease like cholesteatoma. We'll discuss disease stepwise in details. After that, you have to examine the tympanic membrane, as this membrane remains most deeper part of the ear canal, which separate the separate between middle ear and the external acoustic canal. For examining the tympanic membrane, you have to know about its normal color, position of the handle of Malleus, umbo, see about the cone of light. For better understanding, we divided the tympanic membrane into four quadrants. These are upper, lower, anterior, posterior means anterior superior, anterior inferior, posterior superior and posterior inferior quadrants. See the normal tympanic membrane. After focusing your light, you can able to see this structure very well. Here, these are the a bit black line is nothing but the annulus, and long white area is called malleolus, and down to the malleus or tip of the malleolus is called umbo. From there, a light reflex is there. It is called cone of light, and then another important points you have to know about the pars tensa and pars flaccida. Pars tensa is maximum part of the tympanic membrane where three layer is seen, and pars flaccida, which remains at the uppermost part of the tympanic membrane, that means above the neck of the malleus, where one layer is not seen, so that this layer a bit weaker. So any particular disease or any way which interrupts on the ventilation pathway may retract this area, causing some notorious disease like cholesteatoma seen. Now the color of the tympanic membrane. Normally it looks pearly white in color. If any disease remain next to the tympanic membrane, that means in the middle layer, color will be changed. Changing color may red, sometimes yellow, this and that. Sometimes dark color may be seen. And then position of the tympanic membrane. It's normally inclined downwards and medially. But if any disease into the middle layer may protrudes the membrane outwards. Sometimes if eustachian tube is not functioning well, causing retraction of the membrane. So another point to be noted, any retraction is seen or not. Here you can see two pictures. One is retracted tympanic membrane, another is bulging. How you can see it is retracted tympanic membrane? See, if the annulus of the tympanic membrane is well visualized and rest of the tympanic membrane goes down to the middle layer, changing its position is called retraction. And on the other hand, if the tympanic membrane is protruded from its position towards the external acoustic canal and obliterate about the visualization of the nullus. In that situation, it is called bulging. There are some causes which cause develop the retraction, some particular disease which develop bulging of the tympanic membrane. Now the mobility. Sometimes tympanic membrane is hypermobile, sometimes it is not mobile at all. Normally it moves, but not so much or even not too absent. So you have to mention about the mobility of the tympanic membrane. And then surface of the tympanic membrane. You have to make a note whether any perforation or not. If any perforation is seen, then number of perforation, site of perforation, size of perforation, need to make a note, because every points will favor to particular disease. Sometimes the margin of the tympanic membrane is irregular. It indicates that trauma had been happened in a recent period of time. Sometimes it is small in size, sometimes larger in size. Nowadays, it is mentioned as percentage, but you have to mention at least where the perforation is, the number of the perforation, in addition with any discharge or not. If you can see discharge, so color of the discharge, smell of the discharge, and it is coming as actively or just few of its remain in the canal or in the middle layer is to be noted. Sometimes tympanic membrane may appear as chalky white patch. It is nothing but called the tympanous sclerosis. It means some sclerotic change had been happened into the middle layer, which given a shadow on the tympanic membrane as sharp white in color. It's called tympanous sclerosis. Sometimes multiple blister-like appearance is seen. It is called bulla. It is seen in some viral diseases. Now, see the tympanic membrane. Here is a perforation seen in the pars tensa at the involving almost two quadrants of the total tympanic membrane, and the auricular chain is not visible well. I can able to see the milius, but some erosion has been seen. However, you can able to see the perforation very clearly. In another picture, you can able to see an irregular margin perforation. It's called rupture eardrum. It means somewhere it is traumatized so that it appear as it as like it is. Sometimes you can able to see the middle layer if any perforation is in the tympanic membrane. Through the perforation, you can able to see the part of the middle layer. In that issues, you have to be mention about the middle layer mucosa or any polypoidal change, granulation, but the ossicle sometimes round window or oval window can be seen, and what about to see or how it does to look have to mention as well. Sometimes through the perforation you can able to see some foreign body which remain in the middle layer. In our clinical practice, sometimes we can see a piece of cotton bud which remain in the middle layer as of try they were trying to clean their air by placing a cotton bud, resulting part of or whole cotton may remain into the middle layer and came to us or come to us having problems like this. After inspection and palpation, you have to examine further with some special attention. Especially, you have to evaluate about the hearing of the patient by doing tuning fork test, and then to see or exclude any complication following ear disease by doing facial nerve examination. Finally, fistula test to be done. Now, I am telling about the tuning fork test in the particular patient during the professional examination. You need not to mention much, but at least three basic points to be added or points to be mentioned. Among them, one is Rainy test, and then Weber test, and then ABC means absolute bone conduction test. These are the points you have to know for the examination purpose. Nowadays, number of testing facilities are available for excluding hearing loss about the particular patient. So the uses of the tuning fork is very limited because in CSOM, by definition, we can able to know about the deafness. So there is no need to exclude deafness by doing tuning fork test. Tuning fork test is basically still very important for diagnosing or to get an information about the otosclerosis disease. Then, however, still these tests to be done in the exam course. So you have to know about the tuning fork test. The facial nerve examination. It is one of the important mixed nerve which maintain the facial expression. After getting the fire from the origin of the nerve down to the muscle involve the face, which maintain your smile as lovely appearance. More than 43 muscles are involving for make a good smile, and which is maintained by this nerve. So it has an immense importance, and get to know how it can be evaluated. I will take a separate class about the facial nerve in within the next couple of weeks. Sometimes you may ask by your examiner to examine the nose and throat as well, or excluding any pathology remain in the nose or canals or sinuses or even in the throat, which influence your otological problems. So these are parts to be examined as well. Finally, getting all sort of examination, you came to a diagnosis. What is that? It is COM or CSOM. And then Viva discussion proceed to details. Your examiner will ask, what's your case? You will say, sir, my patient is suffering from discharging here, so I think it is a case of chronic otitis media. The next question will be like this. What type of CSOM it is? Whether it is safe or unsafe variety. Means the disease is in the pars tensa or in the etic region. Is it etiquantral variety or debutympanic variety? So we'll discuss in our next class about the details of CSOM, both the debutympanic and etiquantral. Before get to know about your diagnosis, you have to go through detailed examination of the ear by following this way. If any doubt or any question you have about the given part of the lecture, feel free to write me or knock me either by putting a note into the Facebook classroom option or even uh, to phone me. I will try to my best to give your best possible answer. Hope you can able to understand about the examination of a patient and how to deal your patient in front of your examiner during examination. Before to start your examination, you have to be take consent from your patient and make sure about headlight, positioning, speculum, and metallic Jobson horn proof, which helps to cleaning the patient ear and doing proof test and also about the characteristics of discharge in the ear can be excluded. So these are the points you have to show during examination of a particular patient in exam. Next class, we'll discuss both the type of COSM in details. Hope you enjoy this class. Stay safe. Blessing. Thank you very much.